Tonsils are basically normal tissue in the throat on either side, on the back of the throat, and they are actually useful for having providing immunity in the body and fighting infections in the throat. But then they tend to at times cause problems due to repeated infections in the throat, and sometimes they need to be removed. The main cause is, of course, infection, which are the common bacterial infections. Then one can also have malignancy coming into tonsils. So sometimes you have even cancer involving the tonsils. Then in the infection, there is a wide wide range of type of infections which can involve the tonsils. Basically, patient will have pain in the throat and also may or may not have fever. And these are the two main things. And of course, because there's pain in the throat, so there may be also pain during swallowing of either fluid or solids. Anybody actually is vulnerable to tonsils, but generally it is tonsillitis rather. But generally it is seen more in childhood, and as the person grows, then normally the tonsils sort of reduce in size. So the problems associated with tonsil becomes less. So that is as far as vulnerability goes. Diagnosis is, as I said, the symptom which we discussed earlier. Main symptom is pain in the throat and also maybe having fever. Then when the patient goes to the doctor sees the throat and asks the patient to open the mouth so he can see the throat. So on inspection of the throat, generally you will find that the tonsils will be enlarged and they will be what we call as inflamed. So inflamed means they will be more reddish in color, and also they might be whitish spots in it, which is basically the pus which is coming out from the tonsils. When a patient has pain throat and also associated with fever, let's say, which persists for more than a day or so, then it is better to get it checked by a doctor and to see what is the exact problem in the throat. Because it's not necessary that every time a person has pain in the throat or a symptoms related to the throat that it is because of tonsils. It may be other infections also involved in the throat in which the tonsils are not really involved. First is the symptomatic treatment is pain relief, so taking some analgesics, and then doing gargling. The most common gargles which are used are now betadine gargles. Then of course the patient will require oral antibiotics, but again type of antibiotics to be used. There are various choices available. So that normally course anywhere from 5 to 7 days is the routine course for tonsillitis. Basically, keeping your oral hygiene good, that is the most important thing. And if any person gets some amount of sore throat and all, then it is better to start gargling, even with normal salt water or warm water gargling, and then see if the symptoms subside well and good. Otherwise, as I said, then if the symptoms persist, then you have to get it checked with the doctor. Of course, there are various other factors which can predispose. Smoking is a thing which can aggravate tonsil issues. Basically, it's just good oral and throat hygiene, I would say. So, especially after meals and all, clear your mouth properly, cleanse your mouth properly, and of course avoid very cold, cold drinks or very cold water. If at all, it's ideal to mix some amount of normal water with cold water. So avoid having too many of this cold thing.